Good afternoon, everyone, and welcome to today's virtual conversation on domestic violence in North Carolina. I have the pleasure of being able to welcome in our Secretary Gabe Esparza, who is the Secretary of the Department of Administration. He is here with us today to give welcomes and opening remarks. And so, Secretary Esparza, I will first turn it over to you. Thank you for being here.
All righty. Thank you, Sharnessa. Thank you, everybody. And it's a pleasure to join you all today. Thank you for joining this conversation about domestic violence in North Carolina. As you know, October is Domestic Violence Awareness Month. I am grateful to the governor for having issued a proclamation to bring attention and awareness to this critical issue for our state. Domestic violence impacts everybody. As you know, it is a core issue in our community. And while we like to talk about statistics and say there are rates of things going up or down or how large they are, we must always remember that each of these numbers is rooted in an actual life impacted, whether that's somebody's friend or daughter or son or coworker or neighbor. We must always remember that the humanity of these conversations is important to remember. Now, it is personal for me. I've shared this story with many of you during my time as secretary. My mother was a social worker for 40 years in Colorado, where I grew up. And I always remember coming home as a kid and I'm going, "Mom, what did you work on today?" And she could never tell me because the issues were private and, of course, difficult to share. And as I moved into adulthood and came to understand a little bit more about what she did, it was so important for me to be able to honor the work and the legacy that she brought to her work every day, advocating for the lives of children, teenagers, mothers, families. And it was for that reason that when I came to North Carolina, I was honored to join the board of Pat's Place, which is a child advocacy center in Charlotte, and really work on many of these topics that we're discussing here today around domestic violence as it relates to children. And so for that reason, it's personal for me, and I am so proud to be able to be a part of the Department of Administration and the work that we're doing to advocate for these issues. So events like today's webinar help us to educate communities about domestic violence and build support for the policies and programs that we need to fight this scourge. So we are proud to tackle these tough issues here at the Department of Administration, thanks to the work of our newly named or renamed Division of Women and Youth. It is also in this organization that we have the North Carolina Domestic Violence Commission, which is hosting today's conversation, and the North Carolina Council for Women, and we support all of the good work that they do. So I want to thank each of the panelists. Thank you all for joining today. I want to give a specific shout out to my friend, Senator Woodson Bradley from Charlotte, and appreciate you being with us and sharing your story. But thanks to all of you for the work that you do to advocate for these issues. And of course, thanks to you, Sharnessa. As well, as you know, Sharnessa is now our relatively new Executive Director for the Division of Women and Youth. So thank you again. I look forward to the healthy discussion. Sharnessa, let me turn it back to you.
Thank you. Thank you. I appreciate you a lot for being here. I think that oftentimes when folks think about domestic violence or intimate partner violence in general, it comes at a cost of the assumption that that is a women's issue. And so I just appreciate you for being a male in the space, for your investment that you made into our work, simply because it requires all of us in order to do this work well. It impacts all of us in some way. So thank you again for your commitment and for being here. We appreciate it. And kudos to your mother for all that she did to get you here.
Thank you.
If it would not be technology, if we were not experiencing some technical issues, we have a couple of presenters or panelists who have not been able to join us yet. So if our beautiful comms team that is in monitoring that would somehow let me know when all folks are here so that we can make sure that we acknowledge them, that would be great. In the meantime, before I turn it over and call on folks for introductions, just want to go over a little bit just more about gender-based violence in general. A couple of statistics I want to put into the space. Nationally, 1 in 3 women and 1 in 4 men have experienced physical violence by an intimate partner. And while we know that women experience that at higher rates, of course, men and folks of all genders also experience violence, and there's not always pathways for them to seek help. Domestic violence costs the United States an estimated $8.3 billion annually in healthcare and loss of productivity. And those statistics are based on the last 2023 CDC report. These numbers, of course, reflect both the individual and the collective impact of trauma and on those that experience harm, as well as the workforce and the communities that are here for them. And so that's also why today's discussion just really matters, exploring the gaps and the intersections across all of the sectors that you see represented here today. I want to thank all the panelists for giving me their yes. I sent one email and just received so much support for folks who wanted to be a part of this conversation. And so with so many changes in our division and all that we have going on, it is just a delight to me that folks really wanted to show up and be in partnership with us to have this conversation. So again, thank you, and thank you again. So housekeeping. I think everyone at this point knows that when you're on virtual, we always want to make space if we can for some type of a Q&A. And so we will continue that process that COVID taught us all how to navigate. And so in this particular software, you should see a screen that's going to say question and answer. I have been told by our comms team that they are going to be moderating that chat because we're going to leave time at the very end for question and answer. So when as the panelists are speaking, or you have general comments or questions that you want to make, feel free to go ahead and put those into the chat. Do not be alarmed if you do not see those things appear immediately on your end. That is because our comms team will be reviewing those. And at the end, when we get to the section for question and answer, that's when we'll share those out with everybody. So again, an honor to bring all of you here today. I'm going to go ahead and start with round robins of introductions. I'm actually going to call on people in the order that I see them on my screen. If you would just introduce yourself, share about your work and your agency and how it touches the lives of North Carolinians, especially those who may experience harm due to domestic violence or intimate partner violence. And with that being said, I will start with Senator Woodson Bradley.
Had to unmute myself. Hello, everyone. I'm Senator Woodson Bradley. I am a tireless, fierce friend to everyone on this call, but I am a survivor of domestic violence and assault in my early 20s from a boyfriend with the brutal assault, and then almost 20 years later, leaving a marriage where the abuse was affecting our children. And so this is near and dear to me. I campaigned on this issue and people heard it. And I am so excited to be invited to this courageous conversation. And all of you are my sheroes. And Secretary Esparza, I cannot say enough about his advocacy in Charlotte and now him taking it across the state. And I'm so proud to call you a fierce friend. And thank you so much for having me.
Thank you and welcome. Next, I'm going to go to Nikki Locklear.
Hi, excuse me. My name is Nikki Locklear, like Sharnessa said, and I work for the Department of Administration as well at the Commission of Indian Affairs, where I am the program director for the Domestic Violence, Sexual Assault, and Human Trafficking program here.
Thank you. Welcome, Nikki. Caroline Farmer.
Hey, everybody. My name is Caroline Farmer. I'm the Executive Director of the Governor's Crime Commission, which is in the Department of Public Safety. So at the Governor's Crime Commission, we are partnered with a lot of the folks on this call. We provide grants to support the domestic violence services going on across the state and making sure that we have some core services being provided as well, some unique and innovative programs.
Thank you. Annette Taylor.
Good afternoon, everyone. Thank you, Sharnessa. Thanks for the invitation to be here. I am the chair of the North Carolina Council for Women. I serve with 19 other women who bring to life the status of women reports and the status of women in North Carolina. I'm a survivor myself, so this is very meaningful to me. Like the senator, I can proudly say I've helped a lot of women either manage situations they're in or exit situations they needed to exit. Very thankful to be here, to be able to even talk about the subject and how it impacts families and communities. And so I look forward to the conversation and being with all of you today. So thank you so much.
Thank you. Carrie Ann Fisher.
Good afternoon, everyone. My name is Carrie Ann Fisher, and I'm a commissioner on the North Carolina Domestic Violence Commission, and I am also the executive director of the North Carolina Coalition Against Domestic Violence. We are a membership organization that provides support to domestic violence service providers across the state of North Carolina and also works to unite federal policy, state policy, and local policies to do a better job of ending domestic violence and supporting survivors across our state.
Thank you. Susanna Rodriguez.
Hi, everyone. How is everyone doing today? I'm Susana Rodriguez, and I am the Executive Director for State of Harnett County. I have been with this agency since 2011 and have seen many ups and downs and why we continue to do this line of work.
Thank you, Susanna. And do we have Ms. Joyce Cody with us?
Yes,
We do, Joyce.
I'm on here. So I'm Joyce. I'm the executive director at Madison County, my sister's place, and I've been there 23 years. And I'm just honored to be on this webinar to talk about this subject. It's dear and dear to my heart. Also, I'm a survivor and have seen so many different trends over the years, and the strength that people have is just always so encouraging to keep going every day, keep moving forward and doing what we can.
Thank you. Thank you for being here. And certainly last but not least, we have Miss Laura Kovac.
Hi, everyone. Good to be with you today. My name is Laura Kovac. I am with the Cloudburst Group. We are a small women-owned business and consulting and contracting firm. And we are so excited to be working with Sharnessa and her team on looking at the intersection of disaster response and supporting survivors and victim service providers. And we will be supporting the development of materials and toolkits for victim service providers across the state to be able to prepare for disasters. So we're really excited about that. I have been in the field of gender-based violence for over 25 years, working on the ground as an advocate, now as a consultant, and lead the survivor services practice area at the Cloudburst Group. So great to be with you all today.
Thank you all again for being here. And just to elaborate more about our division, as Secretary Esparza said earlier, we are newly named Division of Women and Youth, formerly Council for Women and Youth Involvement. And we are the proud home of the Domestic Violence Commission, as well as the Council for Women Advisory Group. In our work, we do the process of determining eligibility for the domestic and sexual assault service providers across the state of North Carolina. We also have the internship councils. And I just see that actually another one of our panelists just joined. So I'm going to let Jansen White introduce herself in just a moment. Fun fact about our work, because I really love to see public policy in action. We do a lot of things, but for folks that don't know, if you've ever been married or divorced in North Carolina, you pay a marriage license and a divorce filing fee. Those funds are then collected as receipts across all 100 counties, and our agency is responsible for managing those funds in terms of grants that all of the domestic violence center recipients receive. And so love sharing that. Over the course of the day, you will hear more about what the work of our division looks like, as well as all of our partners when it comes to funding and just the work that they do broadly. Jansen White, please introduce yourself. Tell us about who you are, the organization that you're representing, and how it connects with the lives of North Carolinians, specifically those who may experience harm due to domestic violence.
Thank you so much. Good morning. My name is Jansen White. I'm the Assistant Secretary for Government Affairs at the North Carolina Department of Health and Human Services. NCDHHS oversees and supports the health and well-being of all North Carolinians. So that includes everything from Medicaid to mental health supports and services to child welfare, child care, and public health, with lots of things in between that I'm sure I'm missing. So really appreciate the chance to be at the table today and look forward to the discussion as we are really excited to be here. Thank you.
Thank you. So moving into our first set of questions for today, the theme is serendipitous because it was planned this way because we had one of our panelists will have to leave us at 12:30. And so we prioritized the discussion around the impact of disasters and how they increase harm in communities. And that also has happened today as a result of Hurricane Melissa that is now, I believe, already in Jamaica, and they are experiencing harm. And so in North Carolina, we certainly understand that impact. I mean, I remember, don't know how old I was, but my family growing up in Eastern North Carolina, we have been impacted by several hurricanes. Specifically, the one that I remember the most vividly is Hurricane Floyd. I think it was called the flood of the century. We'll talk in a little bit about disaster preparedness, but our family's form of disaster preparedness was to make sure that we were all with our loved ones. And so we would go to my grandmother's house. We would be there until the storm passed, and the next day we would go home, maybe do some cleanup, and do what we can until the next time. And then Hurricane Floyd happened, and we never went home. And so I definitely am sending hearts and thoughts into all of the folks that are experiencing Hurricane Melissa right now. Thank you to Laura for the work that you're going to share with us and your partnership with our disaster preparedness. I would like to pivot to you first before we go to Joyce. Joyce Cody is an executive director of a domestic violence shelter here in North Carolina that was directly impacted by Hurricane Helene. And so she is going to talk about her experience and the experience of her community. But first, Laura, I want to turn it over to you.
Sure.
For my comms team, if you all would start with slide 2, please. Sorry, slide 3.
While the slides are moving, I can get started if that's okay. Really excited to be here with you all today to talk a little bit about some of the work we've been doing at the Cloudburst Group. So Cloudburst, we are a state and local and also a federal contractor, and the majority of our work is with housing and urban development. And we are one of the lead TA providers at HUD providing disaster response. And so we've had a survivor services team and a disaster team for quite a while at Cloudburst. And we were noticing some similarities in terms of how we were providing trauma-informed response, how we were trying to center survivors. There's a lot of language that is common, the use of the term disaster survivor and survivor of gender-based violence or domestic violence. So we started talking to each other and we thought, this is interesting. And we were hearing more from our technical assistants and consulting across the country that victim service providers were really out of the loop in terms of being, one, considered emergency responders, and two, not invited to the table to be a part of the preparedness process for disaster response, whether that was public health or natural disasters. And we learned a lot during COVID around where our strengths were, but also where the gaps were, and how COVID exacerbated those gaps. So we decided to merge our practice areas together to do some research and some groundwork to better understand the intersection. So we conducted a literature review in the late 2023, early 2024 to look at this intersection. And if you could go to the next slide, please. You will see some of the themes that we found in our literature review, because we didn't want to just throw ourselves out there into the community and not really being grounded and understanding, like, what does the research say? What does this look like? So, and some of this is not going to be new to you. Hopefully it's affirming that disasters increase the rate of violence, both in the short and long term, by exacerbating stress for survivors and their families. Harm doers also exploit chaotic circumstances, and they will use these disasters to acquire child custody, isolate the survivor from family and friends, or a survivor may return to their harm doer to have a roof over their head. During the pandemic, survivors were still able to access protection orders because every governor in the United States said we were to be open. I was working for an organization as an advocate and as an educator, and we were open, whether we had the infrastructure or not. And it did put a massive strain on all of our systems, including the court system. And this particular theme came across both domestic and international research that we did. Next slide, please. And then you can see here, violence and coercion during disaster is caused by and increases as a result of there's loss of income and business, loss of housing, there's food insecurity, forced relocation, inequitable distribution of disaster relief. And so from our own experiences working with survivors, we know the toll this takes emotionally and psychologically on their children and family members, and then also these other components, especially housing and economic insecurity. Next slide, please. And then this is my last slide. And I said this earlier, but a resounding theme is that victim services and survivors are not always prioritized in disaster response. And so again, we found this theme across both domestic and international research, and the experiences of survivors are not seen as life-saving, even though we know that violence increases during and after a disaster. There's lack of funding challenges for victim service providers. There's lack of survivor response from multiple systems. Workforce training and capacity challenges can hinder response to survivors. Victim service providers aren't at the table in terms of disaster planning. And then funders and government entities do have the power to bring everybody to the table. And I think there's a real opportunity to address this gap, to include survivors and victim service providers and statewide coalitions and bring them to the table to talk about the unique needs of survivors during disasters. So I will stop there. This is just some of the findings and some high-level key themes that we found in our literature review that's helped us develop a framework to better provide training and technical assistance when we go on site after disaster. So for example, we used some of our framework during the LA fires in January, where we responded and we worked directly with the California Partnership to End Domestic Violence. They were at the table with our disaster response team from Cloudburst. So trying to bring all of these entities together, I think is new for the field. And I will say this, we're really excited to be working with Sharnessa and the Division for Women and Youth, because North Carolina is absolutely a leader in this space, because we're not seeing anybody else doing what you all are doing and developing the tools and products and toolkit that we're going to be working on with North Carolina over the next couple of years. No one else is doing that in terms of centering victim service providers and the needs of survivors. So you all are leading the way, which is really fantastic. And we're so excited to be a part of it.
Thank you for sharing that. Happy to be a part of doing good work. So we had the opportunity to work with Laura's agency, with Cloudburst, as a result of some federal funding that we received through FVPSA, the Family Violence Prevention Services Act funding. And we received a small grant that would allow us to give a few, I believe it was 6 or 8 different awards to counties that had shelters that were impacted by 2 particular named hurricanes in North Carolina, Ian and Fiona. And in addition to that funding for the direct service providers, we also have used that funding to go into contract with Cloudburst Group to be able to Laura's point, create a toolkit and a goal that will be able to spread across the state to all the different service providers. It feels really timely. Happy to do that. That it takes me into the next part of our conversation about emergency preparedness is going over to Ms. Joyce Cody. When Joyce and I were talking in preparation of preparing for today, she reminded me, no matter how prepared you are for things like this, you never know how it's going to impact you until you're in the moment, of course. And so that is just a really good reminder to myself and our FVPSA team as we work on with Laura's team on this disaster recovery toolkit. We have no thought that this will be the perfect solution for all things. This is an investment that we are making because of how valuable we think it is and needed. Even those who already feel very prepared, as you'll hear from Joyce Cody in a moment, things still come up. And so we will continue to learn if as funding remains or we are able to obtain more funding, we can also continue to improve whatever that goal, that output would be. But in the meantime, that is what our goal is. And so we look forward to sharing that with you all. It is very important to me that we honor the voices of survivors and those, of course, who are directly doing the work. And so just as we have service providers on this call today, Laura's team will also be reaching out to the service providers across the state and getting their feedback in terms of what they want to see in this kit. So Joyce, I will turn it over to you if the team would go back to slide 2 with the photos. And Joyce, I'll turn it over to you, just to take your time and walk us through what we're looking at on those photos, and then talk to us about the first 48 hours for your community, for your shelter, for your staff after Hurricane Helene.
Okay, thank you. So I know they're going to put up some photos. There were so many photos to show. I can also say that I probably could not have even been a presenter even just a few months ago. It's taken that long for me to kind of come out of the shock of Hurricane Helene. We are on the French Broad River in downtown Marshall is where our offices are located and where I'm from. And so we had prepared as best we could with sandbags. We had watched the warnings, but it just we could have never fathomed. Our safe house manager was at our safe house who stayed through the storm. We had a generator in place with gas, and we had food, and we had anticipated that we would lose electricity for 3 or 4 days. We actually lost electricity at our safe house for 10 days. So the first, Helene made landfall on Friday, and you can see in the photos, it was 27 feet. It's incredible. It just swallowed the town. The south end of town. It was just hard to describe because the buildings were gone. My sister is the health department director in our community, and she called me on Friday night and she said, like, she kept telling me the businesses that were gone, the homes that were gone of the families that we knew, and told me that my sister's place, the front of our building was gone. And I kept saying, I think somebody told you wrong. I don't think our building, it couldn't be, this couldn't have happened. There's no way this could have happened. And so on Saturday, I made it back into downtown. We couldn't get out of our homes for the landslides. And I always thought if we were going to be planning for a disaster and everything that we ever did at work was for, in my mind, it would be a blizzard. We would have snow in the mountains of Western North Carolina and temperatures would probably go to zero and we'd be looking at ice and snow. But tornadoes, landslides, and hurricanes never really crossed my mind. And so, it was neighbors helping neighbors. It was absolutely unreal. And people were in shock and just showed up with chainsaws to cut people out. And I think some of the most horrifying things was that roads were gone. Like you would be driving and you would realize you really couldn't go anywhere. People used to laugh and say, you can't get here from there, but really you couldn't. And so many people were they were stuck. The interstates were washed away. They were gone. And we began to realize, there was going to be weeks and days. And I think the silence of it was so unnerving because there was no communications for days. We had 3 days and it was just the quiet and the smells. And then we had in our building, we had 10 feet of water come through our building, which was incredible, and left knee deep like sludge, and it was toxic. And so the first 48 hours, we did well as our safe house was on a hill and we had some trees all around us, but it didn't harm. The impacts though were from a disaster like this. We had a domestic violence homicide within the first 3 weeks with a family that we had been working so closely with. And so housing was already an issue in our small towns. And so the towns, we lost so much of our public housing. And a lot of our survivors did have to return to the bad situation in order to survive. I definitely couldn't brag enough on our community and our state. I do want to say, when I got communications back, it was 4 days when I finally was able to drive out and get internet. But Tarnisa had contacted me, Lori Gerber had contacted me, Harriet Sutherland, Governor's Crime Commission, and that made me feel so good because we're in the mountains of Western North Carolina, like a blip on the map that had just been wiped off. But yet everybody was saying, we are here and we know what's happening, because, we weren't sure if people knew what was happening because it was so bad. And so it was really comforting to know that we were being cared for all around, and even after those 48 hours, people just began to come from everywhere. And it was, you would be on the interstate and you would see tractors and trucks, and water was coming and food was coming and diapers was coming and people were coming, like help was coming. And so I was proud of our board of directors and all the things that we had done, because we didn't have the electricity for 10 days and we had enough gas and food where I didn't have to relocate the survivors. We had a full house at our safe house. And so, and our community everybody just pitched in, and it was your neighbor beside you or people you didn't even know. They came to help. This conversation that we're having now, after living through that, is so critical, because there's so many things you don't think of. And with domestic violence, sexual assault, human trafficking, it's just so critical. It's life-saving services. And those people are at such higher risk. We saw a 30% increase between October and December of last year. That was directly, people were in such panic, our survivors, on what to do and where to go. And, jobs were lost, homes were lost, families were lost. And so this, moving forward, I think just for people, when a natural disaster occurs, we'll have the toolkit. will be like, you have just a little bit more in your toolkit to say, we got this, people are coming, we're going to be able to figure this out. I'm not, people are not, you're never alone. You always have a team, even if you can't hear from them in the dead silence. And you see those helicopters flying over for days, that's all you see. That's help coming, so I think that's it. I think that's what I've got. I have my pictures up here of our office and kind of Marshall being swallowed up and the railroad tracks and the inside of our building. There were just so many pictures, so many moments, big moments.
I appreciate you for sharing that. We can probably end the conversation there, because if I'm not motivated to want to go and do more, then thank you for your transparency. Thank you for sharing. Thank you for your resiliency. I'm glad that your organization has you. It's good to hear about the help that was on its way, and pivoting to continue talking about that help as we wrap up that section. I wanted to go to Senator Bradley when we're talking about the disaster response and recovery that has been done for the western part of the state and for those impacted by Helene. We know that the North Carolina legislature dedicated many resources to those efforts. And so I would like for you to just talk about those efforts and your opinion, how they may have specifically benefited and supported domestic violence survivors or that community more broadly.
Sure. And thank you so much for that brave conversation. It's just, I am now coming back from a 5-day tour of Western North Carolina with Leader Batch, Senator Batch, and Julie Mayfield. And we invited other colleagues to join us. They might have had other plans across the aisle, but we went and we had 23 stops along the way in 5 days. And it was a whirlwind, and seeing everything the community has done with limited resources to rebuild what still needs to happen. We listened to what people wanted. Of course, my heart, women, children, families. So if you give me permission, this is going to sound like a bad country song, and then we're going to come out of it. Because when it comes to the hurricane relief, I'm just going to read you this. So Governor Cooper had the damage and needs assessment, which publicly called for the state and HUD funds to be specifically earmarked. There was a huge section of that for domestic violence survivors and shelters. When the Helene bill, the funding that was approved by the General Assembly, it wiped out the damage and needs assessment. So everything that was dedicated to Hurricane Helene relief was focused on infrastructure repairs, home loans, and tourism. We brought amendments. Our caucus brought amendments to the floor. We brought all kinds of things specifically to women, family, children, domestic violence issues. We attached these to every bill that we could, including the budget, and they were all tabled or voted down by a party line vote. These are just the facts. And so we amplified it on social media, and some of those went viral. The good news is that the largest family justice center in North Carolina, I happen to be the survivor on that task force and that board. It's called the Umbrella Center. And yes, it will be in Mecklenburg County, but it will be the largest family justice center, not only in the state, but on the East Coast. And specifically, I went back to them as it opens next year, and we will have a disaster relief mechanism where we can provide funds and resources to all of the incredible people on this call when something like this strikes. So I also wanted to say that we don't talk about VOCA enough. It was a federal program, the Victims of Crime Assistance, and actually was a Ronald Reagan era piece of legislation federally. When that got wiped out, I personally wrote a VOCA bill specifically referencing Hurricane Helene statistics and let that be a launch pad for the state. Unfortunately, it never came out of committee. I got some angry phone calls from from some other legislators saying that was a waste of time. And where we are now, the VOCA resources, if it used to be $10, now as of this year, like $10 per person. I'm just pulling that out of the sky to make an example. VOCA resources federally are now less than $1 per person for victims of crime assistance. That is a statistical fact. It's been crushed down to less than 10%. That's 9 out of every $10 that once supported victim services in North Carolina. These systems were in crisis before Helene. And so we're echoing this everywhere that we can. We're trying to get major media and press to talk about this in North Carolina. But here's where the cavalry is coming. And this is why I'm so excited to be here. I want to give the Department of Administration credit about how the contract that they're assisting with to make domestic violence programs more resilient to natural disasters. It's nearly $1 million in federal funding, and it's not a Helene response, but it's a result of what we know is going to be coming to North Carolina. So this is the proactive work that we all need to amplify. We need to echo this. We need to talk about this. I am very, very worried about the personalities of lawmakers right now glazing over domestic violence, from gun legislation, from natural disasters, from mental health services, from helping kids in schools that are coming to them in crisis. So the Umbrella Center right now has a tremendous amount of momentum for us to launch that program and that across the state. We can talk about that in more length. So why I cannot give you any good news from the General Assembly specifically to this disaster or other disasters, I can offer you that people are listening. More people are paying attention to the General Assembly than they ever have before. And it's a result of the pain that's being inflicted, but it's also the humanity of the majority of our state saying what's coming out of the General Assembly is not reflective of who we are, how we treat our neighbors, how we walk in faith, how we are this growing, robust state. And now I believe, whether it's shaming or logic or whatever the case may be, as we go back into these fractured sessions, you're going to start hearing about this more and more, and it's starting to get media attention. So I promise you, we are holding the line and we're doing everything we can to assist you. But we have a lot of deaf ears that think reconstruction, tourism, other things are more in need than addressing this.
Thank you. Thank you so much. So much of what you said was definitely spot on. I think I want to, for the sake of time, I want to pivot one to Caroline and then over to Jansen for a few questions, but just to bring home the points that you were bringing up, and also Joyce Cody about the impact of the disasters and the funding that went into that. Annette's Advisory Council, we mentioned earlier the Status of Women report and economic opportunities. In that report, if you haven't had a chance to read it, you should definitely take a look at it. And while the report does not directly connect to or mention in great detail domestic violence specifically, it definitely highlights what happens after disaster strikes when you consider the parallels between those who are, for example, already maybe living in poverty, or the gender pay gap, and the amount of money that women specifically are having to invest into childcare, considering the lack of affordable childcare. And so when you consider all of those things, and there's so many more that exist that are outlined in that report, and then you consider like that's already a person's reality. You also have things like, I believe there's a press conference that may be happening right now to discuss the impact of the loss potentially of SNAP benefits. Those same populations that are mentioned inside of that economic report, those are those same groups that we are talking about today that are then going to be more susceptible to violence, because economic security is a form of safety. So just thank you all for what you have offered. Annette, definitely want to pivot to you in a bit just to talk about about the impact of reports such as that and other things you may want to share. But before that, I want to turn over to Caroline, just because it feels like a great segue based on what the senator mentioned regarding the other federal funding, specifically VOCA. And I want to give you an opportunity just to talk more about VAWA funding, the impacts of any cuts there, and the other funding that's inside of your division.
Thank you. Yeah, we've since 2018, we've experienced a 60% reduction in the FOCA funding. So this is starting to really hit our partners at the local level, and we're trying to be sensitive to that and also be as fiscally responsible as possible. With the shutdown right now, we have USDOJ is our primary funder that supports VOCA and VAWA. And these are the primary grants that support domestic violence. So Just Grants was closed for a while. It just opened. And so that has stalled us being able to get our current grants that we were awarded open and moving. So there's no one to actually do anything on the other side of those grants. Now that Just Grants is opened, we've accepted them, but they're sitting there. So that will change eventually, but we will start seeing a delay in our award process. The grants go back to the original date, but it's just delays are being able to award until we officially have those funds. I think for us, we've been moving more and more into supporting our basic grant services. And, we're required to do for VOCA, it's 10%. Have to do 10% required for domestic violence, but we traditionally are doing 20. And I think you're going to see that number increasing just because of the fact that the services are so necessary and the funding's decreasing. So trying to keep them at a certain level, we're not able to keep them at the level we were able to do at 2018, but trying to keep them at a level that we are hoping that they can continue their services as best as possible. VAWA, I mean, I don't know, 70% of VAWA, 75% of VAWA is going to domestic violence. So, most of our grants are really supporting the domestic violence work out there.
Thank you. I just wanted to add, Caroline, that when you mentioned about the delays, that's a very real thing. I mean, our division was just able to bring back some folks on Monday that were furloughed. To the people that are in the audience that are listening, like, well, what can I do when I hear these funders say that their funds may be delayed? On our website and also on the DV Coalition's website, there is a list of the providers in North Carolina that provide the domestic violence services. They are always looking for volunteers. They always take donations. So just keep them in mind as you work on, we're approaching our season of giving. And so just keep those agencies in mind right now as you consider what your philanthropy may look like in this moment, because they are seeing these cuts. You're hearing it directly from the funders. We are all doing the best that we can, and there are powers that be that may require some of this to be slowed down. And so if you want it to give back, that's a great way to do that. And Caroline, it looks like you might have had another follow-up.
Well, I just wanted to say that, the good news. So yes, 60% cut, bad news. But during this, yes, so many people have been furloughed. So many people, because of the fact that we haven't been able to issue grants, have been pausing employment and other things because they don't know whether or not the grants are going through. But for those who have existing grants, we have been able to get the federal money. So I just want to point that out. Every 2 days, we are drawing down the money from the federal government, and knock on wood, that continues. So that's a positive. So as we're moving forward.
Thank you, thank you, thank you.
you.
Coming to you next, Annette, but going over to Jensen and just continuing on with the theme of funding cuts and impacts. We know that North Carolina expanded Medicaid nearly 2 years ago, and nearly 7,000 more North Carolinians now have health care as a result of that. Could you talk about how Medicaid expansion may help domestic violence survivors and other vulnerable people in our state? And the second part of that question is, how are these gains threatened by a lack of a state budget and the other looming federal cuts that Caroline just mentioned?
Yes, of course. Thank you for that question. Again, Jansen White at the Department of Health and Human Services. So yes, as you mentioned, Medicaid was expanded nearly 2 years ago, and nearly 700,000 more North Carolinians have access to healthcare as a result. It's really helped reinforce the entire state's healthcare system by providing a payer of otherwise uninsured individuals, which really benefits the individual, but also the whole healthcare system as a whole. So when you think about things like uncompensated care, or care being provided for free, individuals accumulating healthcare and medical debt, a generally sicker population, and individuals seeking higher cost care later rather than lower cost earlier and preventative care. So Medicaid expansion helped with a lot of those things. They made people healthier. It made local economies stronger. It made local providers more sustainable and really helped maintain points of access for everyone, including, domestic violence survivors. And so I think that's really important when we're talking about the role DHHS plays, building a healthier and well North Carolina. We're really focused on ensuring and protecting those points of access. I think federal cuts, as you mentioned in the reconciliation bill or HR 1, and we can talk about this more in depth later, I think in another question, but hit hospitals hard in particular, which really undermines rural hospital finances. And this is what is important to know, is that it reduces those critical points of access that we talked about, that I mentioned earlier, across the state, and could negatively impact local economies. We're talking billions of dollars being pulled out of local economies. Also, as you mentioned, state level cuts to Medicaid also pulls money out of local economies. This means providers may see less Medicaid patients, or pull out of Medicaid entirely, or scale back on other initiatives to save money to make up for that lost funding. All of these things have a consequence, reducing access to care and reducing those access points.
Thank you so much for that. I know inside of our report, there are, again, a lot of great content, but it mentions and highlights the fact that a lot of women that are in the workforce are hourly workers. And so you have to compound that with the potential loss of wages when they are having to be out of work as a result of receiving harm. And now that's even more compounded by your remarks and what we all know is happening with the loss of just healthcare access in hospitals in rural communities. So now you have those survivors that, by way of the lack of resources and the infrastructure to support them, that is also how survivors end up having to stay or return to those situations, because the safety nets that they should be a right for them to have are not there. And so it forces them in that situation to be with those folks that cause harm. So thank you for sharing that. Annette, obviously, I love the report that we wrote and or produced, and so excited that we always get an opportunity to highlight it. And I want to turn it over to you to talk about from your perspective, the significance of that report and reports such as that.
Thank you, Sharnessa. Well, I do want to echo our panelists and those who believe that North Carolina is leading the way in these many areas, certainly with the disaster and the ways that we've invested in helping women and families recover during Hurricane Helene. I know it's not over, but thanks for all of those comments, and Joyce for what you've done. And I also want to, echo Senator Bradley and all that's going into, making policies happen that support women's quality of life. And so as I bring attention to the reports and kind of highlight it, I want to say that North Carolina led the way in just creating a statewide advisory council of women who have a platform and are being very intentional about the status of women in all of these different areas, because, we need to make sure policymakers and influencers and other stakeholders make the best decisions they can to help improve the quality of life for women. And so even just mentioning housing, I mean, if people aren't thinking about the lack of housing and people are not thinking about the lack of childcare, we're already dealing with economic inequality when it comes to women. And the gender wage gap is changed just a little bit. I'll say that is one of the things we noticed in this new report and the research that was done. It's changed slightly from 81% to, 83% of earnings for women compared to men's earnings. But it doesn't necessarily move the needle when we think about the rising cost of childcare and the childcare crisis that North Carolina has, that, of course, our leaders recognize and have created task force around. So, but just to mention a bit about our recent report that was released in August. And let me just say, I want to thank the state leaders from all of the various agencies whose investment in this report made it possible. So I thank them for their partnership. But it was the 6th report in the series of the series that we use to analyze the key issues around women. And this one, we talked a lot about childcare and barriers to economic security. We found that North Carolina women are working full time. 20 to 26% of their annual income goes into childcare. We recommended that there be a task force that focuses a little more on childcare. I think we're making that happen. We are recommending that there's an increase in North Carolina families' access to childcare by more investment in a childcare subsidy. And so, I'm going to pause there on that report and actually bring attention to our 2019 Health and Wellness Report, where we learned that North Carolina actually has a D because we score the status of women in North Carolina. And, at that time, and I don't think much has changed, there's a grade D for women when it comes to our rates around intimate partner violence. I mean, we're 35% of North Carolina women experience intimate partner violence and sexual assault. We also know that 13% are uninsured. So thank goodness for Medicaid. And I think that has made quite a difference, although I know that it is currently being threatened. And so our recommendation, even back then, and it remains the same, is that there is increased funding for survivors of interpersonal violence and sexual assault. We know that this is key everywhere, and disasters do not help. You all already mentioned that, so I'm echoing that when women face being at home more often with their abuser, then it just makes things worse. Of course, it affects their ability to earn income and to care for themselves and just have economic freedom. I mean, financial freedom. We believe rural areas, of course, is a critical factor. And then back to the point about our rural health centers and just access to even specialty care is really a concern of ours. And we are always focused on recommending more investments for survivors and for women in general, for the many different ways that we contribute to the economy. We believe that we need to, have more focus on investing in women's economic security.
Thank you, Annette. Carrie Ann, I do want to go to you to elaborate on comments that you just put into the chat. Annette, your remarks are very timely when you mentioned the 2019 report and specifically the increase in funding. While we just heard from Carolina, we know that the federal VAWA and VOCA funds were cut. Our division was able to see a slight increase thanks to the General Assembly, which gave us the reoccurring increase of funds for our domestic violence and sexual assault services. services through the Domestic Violence Center and the Sexual Assault Center funds. I'm really glad to be at the helm of an organization that's responsible for a very small piece of stability, because while our partners at GCC saw cuts and continue to see those cuts, we did see an increase thanks to our General Assembly. But I also recognize that the amount of funding that we give all of our individual service providers is much smaller than what some of those federal awards could be. The total amount of the award is large, but when you divide that based on the statute, equal shares for all 100 counties. We have 104 programs that were eligible this year. So the General Assembly gives us $3.7 million. We divide that 3.7 equally by all the programs that are eligible for services. And so that is a symbol of, I guess, a beacon of stability. Of course, we would always take more so we can give folks enough to provide overhead plus salary and all the other things, but we are appreciative of what they have given us at this time. So Carrie Ann, I want to turn it over to you to elaborate on the comments that you put into the chat. And also, I mean, there's so many things that we talked about that you, being from the coalition, can definitely speak to directly. So I want to pitch it to you to share your thoughts, and also just let Susanna and Nikki know that with both of you working with directly with survivors, I also want to hear from you all anything that you want to add to this conversation after we go to Carrie Ann. So Carrie Ann, I'll turn it over to you.
Thank you, Sharnessa, and thank you to all the panelists who have spoken so far so eloquently about what's happening in our great state. Certainly the difficulty we see in North Carolina is that we were in a perfect storm in so many ways, even before any natural disasters impact us. What we're seeing is due to the affordable housing crisis, that shelter stays are longer for survivors of intimate partner violence, which then means there is no space for many survivors when they reach out for assistance. In terms of needing a shelter stay, they can still get so many services from local programs, but even those staff are working longer hours. We hear about executive directors working in thrift stores because somebody calls off. We hear about executive directors answering the hotline instead of being able to be there necessarily to supervise and train other folks. So it creates a really difficult environment for many programs at a time when the needs are increasingly greater and the severity of the cases are increasing. So one of the important things I really appreciate that Senator Bradley shared is pieces about funding, because funding leads to housing security. Funding leads to transportation. Funding leads to healthcare and mental health care, and all of those are the building blocks of safety. So funding for domestic violence is funding for safety, and we all deserve to be safe at home.
So well said. Thank you so much. I want to go over to Nikki. Nikki, you work here at Department of Administration, specifically in Indian Affairs, and I would love for you to just talk more about survivors and American Indian communities and the any distinct barriers that they face. I also would love for you to share any success stories of any effective interventions that your division has worked with the communities that you served.
Absolutely. So, of course, survivors and victims in tribal communities face all types of barriers. And I think one of the number one things that, one of our number one barriers, period, is just trust, period, just trust of governmental systems, trust of each other, trust of other tribal communities. When it comes to American Indian victims and just tribal communities, period, it is a lot of relationship building, a lot. And just because we come from the Commission of Indian Affairs, that doesn't mean that we automatically have an in. So it takes a lot of relationship building, absolutely, in order to get people to trust you, in order to get tribal chiefs and administrators and chairmen to trust you as well. And the other thing is, you have to make sure that when you're going into these communities, you're respecting these communities, and that you are asking, like I said, these tribal chiefs and these tribal chairmen, is it okay if we come into this community and provide these services for your people? And what kind of services, do you feel like your people need? What are they asking for? Because each community is different and each community communicates differently as well. So we want to make sure when we're going into a community that we've talked to, like I said, the higher ups there, the chiefs, and make sure that they understand what we're coming to do and make sure that they are a part of the conversation with us. We're not coming in there to say, hey, we have all the answers. We've got this person on the ground to do this. We have safety plans. We're providing all the services. We don't want to just assume that we have all the answers. So we want to make sure that we engage them in these conversations. And so, like I said, I think relationship building is really the number one thing. And that doesn't look like sending out an email. That doesn't look like making a call. That looks like going to that community, asking for a meeting, respecting their time, knowing how to, like I said, communicate with them, knowing how to speak to them, knowing what to call them, because some tribes have a chief, some tribes have a tribal administrator. So just making sure, like I said, that you're very respectful of these communities before you just jump right in and feel like you already have all the answers. When it comes to some of the interventions, I feel like we've done a bunch. But one of the number one things that I really enjoy the most is any type of presentation or workshop with teens and with our youth specifically. Because that is, of course, where it starts, is where prevention starts. Absolutely. And we want to engage them in these conversations as soon as we can. And so when it comes to our youth, we have a youth advisory council called NCNAO, and that's the North Carolina Native American Youth Organization. And they have a conference every year that is held on one of the college campuses here in North Carolina. And it gives the kids like a college experience. So they're able to stay in the dorms, and there are workshops and presentations on various things. And so the Commission of Indian Affairs every year has a workshop there. And so it started out as a workshop with all of us, just kind of explaining what our programs are and the services we provide and things like that. But when it came my turn and I got up and we got on the subject of social media and social media's influence on relationships. I mean, these kids, if you let them talk, they will talk. I mean, they are so smart. And they want to engage in this stuff. They want to hear what your advice is. And it's so cool listening to them talk about the influence that social media and just people around them have on the relationships that they have. Because we talk a lot about relationships, period. And you'd be surprised that some of these kids just don't really understand that you can have relationships. A relationship is not just between a boyfriend and a girlfriend. We talk about relationships with our teachers. We talk about relationships with our parents. And so they also don't necessarily understand like the dynamics of relationship. Like when it comes to respect and communication, really basic things, you'd be surprised. But they have a lot of opinions. And like I said, it's real cool listening to those opinions. And so, like I said, we started out with this presentation, and like I said, when it was my turn to go, the kids were just so involved. And so then I started getting a request to do a standalone presentation. And so just this past year, I did, I think my second standalone presentation, and it's like an hour and a half. And like I said, these kids get so engaged on relationships and red flags of relationships, because I honestly, my job is to kind of put it out there and really let them do the talking, because that's really where the engagement comes from. They learn from each other. And so, but it's interesting though, when you put that out there and you let them do the talking, that's when they come back to you and start asking you what your advice is. Well, Miss Nikki, what do you think about this? What would you do in your relationship? And so it's good that even though you give them the floor, they'll come back to you and want to know, like, you're the professional here. What do you think is right? And so those workshops, I have learned so much with those workshops. And like I said, the kids love it and they don't want it to end. Like the last time they wanted to stay for like my second session. But it's just so cool. Like I said, just listening to their perspective, and giving them the floor. Because like I said, once you put it out there and you give them the floor, you just learn so much from them.
Definitely agree. I appreciate you for sharing that. I think you'll have to come back. We will have to do something for in April. April is Sexual Assault Awareness Month. And as you were talking about the different levels of intervention, I often think about like programs in the state like RPE, rape prevention education, that talks about just basically the socioeconomic, the CDC model approach to like violence and how you intervene. And there is a lot of content in that discussion on the importance of investing in and educating youth at a very early age, and so that you can interrupt those cycles of violence. So I definitely agree with you. The education is definitely a pipeline to making sure we reduce that. I appreciate you for sharing the feedback around the cultural sensitivities when engaging with Native communities. If someone is on the call, listening in the audience, and you live in an area that has a Native community, definitely reach out to Nikki's office if they can be of any help and how you may be able to bridge that communication, get those introductions and so forth and so on. So Nikki, thank you for that.
One more thing, sorry. Sure. I just wanted to say that we do have a family violence prevention task force now as well, and that comes from FIPSA funds. So thank you, FIPSA. But we are in like our third meeting now, and if you're interested in learning more about it, please also reach out.
Thank you, thank you, thank you. So in about 4 minutes or so, we're going to move to the Q&A if there are any questions. I want to go over to Susanna. I believe we have not heard from her yet. Susanna, I don't know if you're able to come on camera. If you can, we'd love to have you in the space. But the question, so I've known Susanna for several years. I think I've been in the field since 2007. And at some point, I had the opportunity to work with Susanna. She was not the executive director at that time, but we worked together on a program called ERS. It was Enhancing Rural Strategies, and it was when I was working at the State Sexual Assault Coalition, and we had the opportunity to fund different programs across the state that were sexual assault service providers to build what was known as sexual assault response teams or coordinated community response teams. And so there was a partnership between NCC-ADV and also NC CASA, and Susanna was the program lead, the SART coordinator on that. So love the fact that, bringing that full circle, seeing that she is still doing all the great things when it comes to collaboration. And so Susanna, with that being said, I would just love to hear from you. Your organization serves a very diverse background. Can you talk to us about some of the strengths or the unique strengths or any challenges that you've been seeing recently and also over your time? Again, you have been in the field for a while. So yeah, we would love to hear from you.
Absolutely. Thank you so much. I do remember that. Lots of learning, lots of curves. I turned my camera on. I was on camera. It just removed me. I'm not sure if that's just a technical glitch. Can you all see me or no? No. Okay. So yeah. And my camera is highlighted to where I can't turn it off or on. So I'm not sure what happened.
It's okay. It just means you have to come back another time. Well, thank you for trying. We still want to hear from you though.
Yes. So some of the things that we have learned and experienced here in our rural community, I guess the challenges first, confidentiality concerns, transportation barriers, even with e-court filing. I think that that's great that we're moving towards that, but there's still so many gaps and so many different issues that we face because we heard that e-filing was coming to our community. We were excited, wrote all these grants so that we can have laptops for individuals that are walking in for assistance and so forth. And the barrier that we face now, even now, years later after it rolled out in our community, we're still having the issues where they file online, but then they have to wait to receive an email letting them know when they have to be in court. And that's not leeway to say, oh, you can't come today, we're going to do it tomorrow or any other thing. I mean, they'll tell you be here at 3 o'clock, be here at 2 o'clock. That still creates that barrier for those that don't have transportation. And now you're given a time frame of when you have to be there or not even knowing. So a lot of the work that we're doing is trying to move towards that, but also we're still doing the protective orders, on paper and having them walk it, straight into the courtroom themselves and hope that, there's a judge available and they can be seen. So we're still working on, things like that. But those barriers are still something that we're experiencing. The confidentiality concerns also when there's family ties to the legal system and requesting an outside judge for a family member who knows someone, whether it's a judge, someone, the clerk, or even within law enforcement, or even when law enforcement is the perpetrator. And it becomes difficult. Of course, we know they can file the DVPO in a different county, but when the criminal charges are happening here in this county, they have to file in this county. So trying to get that across, and it's difficult because it looks like it's already overwhelming for the client to even come forward, knowing that there's so many things stacked up against them. And then to also have to face and say, well, they know someone in this position. And unless we're able to bring an outside district attorney judge to hear these cases, the client feels like everything's stacked up against them. So there's so many barriers that we face, and also with immigration concerns. And then, of course, the further isolation of the affordable housing. In the bright side, also having a small knit community in the rural area is it also brings a lot of strengths. A lot of the strengths that we focus on is gathering the nonprofits together. There's nonprofit meetings that happen quarterly, monthly, depending. We tend to change them a little bit depending on what's going on in everybody's lives. But those are really good for collaboration and networking, getting to know what the gaps are in our community, what our needs are, and is there someone already serving that purpose, and we just haven't really, came to across our table. So really helping build those collaborations and that network, as well as closing those gaps that we see that are there, so that we're not recreating the wheel, or that we're not stacking up the same services across, so that we can further enhance the work that we're doing. We're also have Harney Community Leadership Summits that focus on interactive sessions where participants will collaborate in small groups to explore solutions to key issues related to what's happening here in Harney County. We're rapidly growing, which means that, of course, affordable housing is out the window. Same with affordable childcare. The things just continue to stack up. So knowing that there is other leaders in our community that also want to address these concerns really, really is important. It's key. And building these collaborations and focusing on that is really important. I mean, like Charnessa just said, we started with the sexual assault response team many years ago, and that's successfully up and running. We had a little downtime with COVID, but that's successfully up and running again. And that really helped us put our foot in the door, because we were already knocking on these doors, years ago. We built that connection so that other things can also develop. So we're still working with the key players for that, as well as the leaders in our community and also nonprofits, to try to reach those gaps and close transportation and confidentiality concerns, and see what else is dire in our community, and addressing that is key.
Thank you, Susanna. I want to remind folks that again, in a few minutes, we are going to pivot to taking questions. So if you have questions, I can't see them yet. So forgive me if you've already put some in the chat, but if you haven't, put some in the chat if you have any. We will get to those in a few minutes. Just want to follow up on some of the thoughts that Susanna made, specifically as it relates to collaboration. The folks, there's so many great advocates around the state, and so many on this call: Susanna, Cody, Joyce, Cody, Nikki being one of those folks that are still, community-based advocates, Carrie Ann's group. And if you are listening in, are experienced harm, domestic sexual assault, you can get in touch with the victim advocates at these agencies. The compassion that you heard today is also the compassion that you should be able to expect when you walk through the doors of any provider that receives money from Division of Women and Youth, so that you can get the help that you need. Susanna mentioned hesitations. Nikki did the same thing, mentioned hesitations that folks may have when it comes to engaging with different partners. It's just really important to remember that that is a normal feeling, and the purpose of advocates is to help to bridge that gap. And so we work to just make sure that the partnerships that exist in the communities between advocates and law enforcement, between the courts, that we can strengthen all of those things, because if we don't, ultimately it is the survivor that suffers. When I was a trainer, having to do trainings on interventions between domestic violence service providers and law enforcement, I used to remind advocates that, you know, we want a good investigator that is going to be in the field doing the research and investigating the crime, right? So what that also means is when your victim calls you because they're upset because that officer could not answer the phone call in that moment, that might actually be a good thing, because we want them actually out investigating, right? And so we just want to just remember those collaborations, that everyone has a job and a role to do, and the benefit of engaging with the victim advocate, regardless of what side what part you are involved in the process. They can absolutely help to be the liaison so that that survivor still receives some support, trauma-informed response to what is going on, and you can continue in your respective roles doing what you need to do based on what the survivor has asked. And so thank you for that. I want now to, before I ask the panel if there are any other thoughts or comments that they would like to add before we get down to our last question. Are there any questions that are already in the chat right now that we could go to?
Sure, Nessa. I'm glad to read a couple of questions. I'm going to sort of combine some of these a bit, as there's some overlap here. But we're getting some around, you were just talking about collaboration. So this is exactly on point. What are some ways that experienced providers as well as survivors can come together to collaborate? Do anybody on our panel want to take that question or provide some suggestions about those who are looking, excited about this conversation today, looking to take the next step and figure out a way to become more involved and collaborate?
I'll provide a quick answer. So I think one of my best ways right now of collaboration is myself, Carrie Ann, and Monica. We have a call monthly, just to kind of discuss what we have going on with our programs, any concerns that we may have. We talk about all types of stuff, and just getting that meeting on the calendar and just leaving it there. Now, sometimes there are months that we can't meet, and so we have to meet the next month. But having that meeting put on the calendar every month, we know when it's going to be. We continue to have it as much as we can. I mean, I think that's been one of my greatest ways of collaboration, especially with two people who are very, very busy people. So I definitely appreciate that suggestion from Carrie Ann last year, I believe it was, and we're still kind of going strong with our meetings.
Awesome. Thank you, Nikki. It looked like, Senator Bradley, you were going to unmute yourself.
No, I love that idea of collaborating and meeting here. We have taken these conversations to the public schools and got them approved with something called Love Speaks Out. It's a teen dating violence program. It's completely appropriate. Parents can opt out. They're notified that they're going to do this. But we've been able to collect data through a partnership with UNC Charlotte, where it's the one time they can have their phones out in class and anonymously answer questions of things going on with themselves or in their home or with people they know. And through over 88,000 responses through CMS school system over the last 5 years with this program, we have been able to we can target different areas, different schools, and bring the providers together to give support to these teens that they feel safe. And they feel that they are having a brave conversation by actually bringing this out of the shadows. The youth are really starting to understand that nothing's going to stop unless we address it. And so I'm just saying I think the more creative we get, listening to y'all, I've been taking notes. I've been putting notes in my iPad. I've been writing them down, of hearing all of the good things you're doing, of how we can amplify that. But that is something that we've done through the community, through schools. And it's really helped a lot, of us really kind of finding out the origin stories of some of these families and preventing teen violence, especially when it comes to the LGBTQ community and young men having the courage to say they have been abused by a partner. That because there's a lot of shame in that we've been trying to message and help around it. But to your point, Carrie Ann, everybody should be safe in their relationships. Everyone should be safe in their homes. So
Thank you for
Darnessa,
lifting up.
if you don't mind, I was just going to add also for those on the in our audience today, anybody interested in collaborating, the Domestic Violence Commission and our Council for Women, those are public meetings. They are open and we would welcome you to attend. Some of them are in person and some of them are virtually, but you can get all the details about when and where they meet on our DOA website. And I know we'll be providing a link at the end of that, but I would certainly, on behalf of DOA and on behalf of those councils and commissions, we would welcome your input and your attendance. So thank you.
Thank you. I don't know if you were on camera, but I just wanted to say the voice that you all were just hearing was none other than our Deputy Secretary, Noelle Talley, who we're so happy to have with us, doing what she does great, which is resource sharing all of us up. And so thank you for sharing that that plug about boards and commissions, Noelle. We appreciate that. Someone else had just come off mute. I think they wanted to add something, but I don't know who that was.
Susanna.
Hi. Okay. Yes. Thank you.
Yeah, just really quick, more than likely, if you're thinking of collaboration, just know that there's other individuals out there that are thinking the same thing and just don't know how to get started. So best course of action is, when you find one or two individuals, start that meeting and then just start adding individuals. Who else should be at this table? And just, who do you know? And it starts really small. And next thing you know, you have, a leadership summit, or you have a nonprofit meeting, or you have, different collaborations, networking, growing pretty fast, just putting it out there and it will grow.
Thank you so much. So we are down to our last 2 minutes. I want to circle back really quick before we do our round robin of closing reflections, because it feels really important just to name, the senator has mentioned earlier about origin stories. And so what came to mind to me is a lot of advocates, their origin story starts at the end of a tragedy, specifically domestic violence, homicides. And so if you've seen the media lately, we know that there has been an increase in uptick in domestic violence homicides. And so I want to pitch it to you, Carrie Ann, and then go to Caroline Farmer just to talk about how the DV homicides, why it's increasing, what we know about it, and any work that your respective organizations are doing in that area before we close out. Thank you.
Yeah, I think one of the big things that we're seeing in regard to domestic violence homicides is that a victim/survivor of IPV is 5 times more likely to die when their abusive partner has access to a gun. And so one of the really important areas to look at is the intersection of firearms and DV homicide. And I will say the coalition is incredibly grateful to Governor's Crime Commission for their efforts in looking at DV homicides and working toward reducing them in our state, because there's just such a profound impact on our communities, homes, schools, every time there's a DV homicide. And we're also seeing an uptick on multiple deaths in coalition statistics around either murder-suicides or homicides where children in the household or other family members are also killed. So the numbers per event are higher right now. And it's very scary when we're thinking about the impact that actually has on neighbors and schools and friends, family members, and communities.
That's exactly why at the Governor's Crime Commission, we have down the domestic violence homicide reduction as a priority area that's across all of the topics, just trying to make sure that we highlight that as the problem that it is. And, let's be honest, y'all are the ones with the answers. And so having that funding opportunity for you to apply, it starts in December, the next round. So I'll put a link in the chat so that everybody will have the link for the grant information. So, but thank you, and it's been wonderful partnering with Carrie Ann and her folks on this.
Thank you, thank you, thank you. So I know we are at time for folks who have, not the panelists, but for the guests. If you have to jump, please do that. This is being recorded. We'll be able to repost it later. I'm going to ask the panelists to just hang out for a few more minutes so that if folks do revisit this later, they still have the full session. And I want to end with asking you all our wrap-up question, which is, as all of you represent various unique places of influence in your respective roles, what is one commitment that you believe leaders across different sectors can make today to help ensure the safety of or show meaningful support for victims and survivors of domestic violence? And I'm happy to call on folks, or you all can
jump in. First of all, just having the conversation out in the open. There's not a person that you know, work with, live with, worship with, commune with, that domestic violence has not affected someone that they know. Number one. Number two is absolutely making this a focal point that the business community needs to get involved. This is an economic issue. This is a healthcare issue. This is an education issue. This is a human issue, and it's not a dirty thing. There's nothing to be shamed about. Having been shamed years ago in my situation, and now realizing now that the shame should be put on the perpetrator. And I think that the world is changing with how they view it. I think it's changing in how we address it and all of these things. So my commitment to everyone is, like, we have run 18 different bills and we have run over 23 amendments on the floor, specifically addressing domestic violence in every shape or sound. It is getting attention. I will be committed to that, but also in the community, and just be a partner with all of you in anything that you need. But that to make this, every single issue hot button that starts coming up, especially in the near future, domestic violence definitely has a place to be discussed.
Thank you. I will have to go to Annette and then to Jansen.
I'll be quick. Thank you so much, Vanessa. I wanted to address the barriers that Susanna spoke to around online access, e-courts. I know it was intention to be discussed. As the person leading the charge on closing the digital divide, I do want to acknowledge how it is a safety risk for victims to not have access to affordable high-speed internet. We've been talking about affordability on all these other issues, housing, of course, childcare, but internet is a major issue, and affordability of it is a barrier for many people. The over 1 million people in North Carolina, we're trying to address that. But of course, I've spoken with Carrie Ann before, and we just want to make sure people are safe using devices in general. But the ways that we're working to close that divide is, one, providing resources for access to high-speed internet devices, the right type of devices to meet their needs. And let's not forget, there are many victims who are also disabled, and they have to have the right type of devices to meet their needs. We have to meet people where they are, as well as digital skills. Listen, folks, not everyone on here has access to an email address. And as we know, you cannot do much online without an email address. It's pretty much required. So do know that we have invested millions in partnerships across the state to make sure people have access to the resources, whether they need to call 211, which we have a Digital Navigator partnership, with 211, so people can just call that hotline that the United Way of North Carolina provides. So someone can call and say, hey, I need to know how to get an email address. I need to know how to get online, or where in my community can I get online? I mean, is there another place besides the library? I mean, there are lots of different resources that we have collected inside of this resource database on our site, as well as telehealth is critical to this equation we're talking about. And I do want to give credit to the General Assembly and Senator Bradley and her colleagues for investing over $1 billion in infrastructure and adoption programs for our residents. And I also want to just say that I think the workplace and companies need to get involved. Domestic violence can also be rampant in companies, and people can be victims in companies, like I was. And, I'm thankful for the fact that I was able to survive because of some policies that were put in place by my workplace when this happened to me 30 years ago. So just want to thank all the panelists for your feedback and input here, and look forward to collaborating with all of you.
Thank you so much. I think I was next in line, so I will pop in. I just think I am so impressed and in awe of all of the great work happening and by all of the organizations, agencies, and people represented here today. And I think at DHHS, our mission and our commitment is to prioritize creating an environment of health and well-being across North Carolina, because that has to be the base to support all of the great work that all of you are doing and all of the work that your experts are doing. And, we talk about health and well-being together really specifically because people and their families cannot be healthy if their personal well-being is not addressed. And feeling and being safe is a critical part of that. And as I mentioned, whether that's healthcare, childcare, which is also within our department, SNAP, food, behavioral health, I saw someone in the Q&A mentioned our Healthy Opportunities pilot program, which specifically serves people at risk of interpersonal violence, which unfortunately was not continued by the General Assembly. But, our commitment and our mission for the state is to make sure that we do everything we can to create that environment of health and well-being to support the people of North Carolina and the people who are doing this more intense and direct support of survivors of domestic violence. So I appreciate DHHS being invited today, and it's really amazing to hear all of the great work being done. I appreciate it.
Thank you. You're so welcome, Carrie. I'm gonna go to you. I saw her hand.
Yeah. Thank you, Sharnessa. I would say my message would be that every person in the state of North Carolina and beyond should know their local resources and be prepared to share them when someone comes to talk to them, and to learn how to ask questions in a trauma-informed way and listen non-judgmentally. Because the moment, as we said, everybody knows someone who's experienced domestic violence. The moment someone knows that you know something about domestic violence, people start coming to talk to you about the fact that they've experienced domestic violence. So it's incredibly important that people be prepared to hear the story, to ask the questions in a trauma-informed way, and connect that survivor with someone who's trained in safety planning to know the resources in their community so that they can make that connection.
Thank you. Thank you. Is Joyce Cody still on the call? I'll go to Joyce, Susanna, and then end with Caroline. I think we'll have heard from everyone. Okay, we may no longer have Joyce. Caroline, or no, sorry, Susanna.
Yes, thank you. I think it's really important that we're, like stated earlier, is that we're acknowledging that this is happening and that this could happen to anyone. I think that's going to be, the biggest thing. The other thing is working on the continual funding, sustainability of the programs, and of course, continuing to work at making laws stricter, and that are also working for affordability, because when we're helping a victim leave, they're looking at housing, childcare, and everything else stacked up against them, and including, even the equal pay, just being able to afford to leave. So I think that those are really things that are really important and dire to be able to sustain an individual who's trying to leave a domestic violence situation.
So important. Nikki, I did not mean to skip you, but I would love to hear from you next as well for your closing reflections, please.
Yeah, so I just wanted to say, and I know this is not really popular right now, but we have to remember our culturally specific communities. And we have to also remember that we, like I said, because when it really comes down to trust. And so we want to make sure that we are culturally informed. We want to make sure that we are providing culturally relevant services, especially if we're in a cultural specific community. Because the whole point is to get people in the door, right? You want to get people there. And so the best way to do that is to make sure you're offering the services that they feel more comfortable with receiving. And so, yeah, I just want to leave people with that. Like I said, it's not, I know people don't necessarily want to hear it, but yeah, offering these services, especially if you're in that type of community, and just remembering that specifically American Indians, 84% of women experience violence in their lifetime. So yeah.
Thank you for that reminder. And Caroline, if you would close us out, please, with your reflections.
Sure. No, I was going to say that, I think for leaders, hearing from the communities and truly listening, being in relationship with them and understanding perspectives and varying perspectives across the state. This is a pretty broad state. It has a lot of barriers that are different in each community, and listening to those and knowing that they're the experts and listening to what their solutions are, I think is critical.
Thank you so much. Well, thank you all for joining us today. We could be here so much longer. We just only scratched the surface, but thank you for all that you contributed today. Thank you again for your yes. To the participants, please know that we will, the reporting will be made available, and any of the resources that we can share that were mentioned today, we will send those out to you as well. What you're seeing on the screen now is the contact information for the folks who were on the call today, but we will send that out for you, your access at a later time. So with that being said, we just want to say thank you so much. Have a great rest of the day. And until next time, bye-bye.